Welcome back to another episode of Diabetics Doing Things. Today, we have a very special episode for you. This is episode 199. And while we've done certainly like 35 or so Tools of Type 1 episodes back in 2018, we're coming up on episode 200, which is a pretty cool milestone for us and for me. But today's guest is Mary Mosier. She's a type 1 diabetic and she's a licensed marriage and family therapist. And we've been talking a lot about mental health. We had a mental health awareness month and series on the podcast, and Eritrea, who's here with me, and I have discussed mental health and the burden that diabetes places on that at length. But we've never had an expert like Mary. We've had some other clinical psychologists, but this discussion was really on the trauma of being diagnosed with diabetes and the effects that it can have on you long term. And I really think that you're going to gravitate to Mary. She's just a really great presence. And I know I walked away from this interview feeling better than when I came in.
I think we both learned a lot, right? How the way that I think something we talk about a lot on the podcast is that initial response to being diagnosed. And we finally got some answers to that question and just more things around the grief of diagnosis. So we learned a lot, and I'm excited for everyone else to listen to this episode and learn with us.
Yes, indeed. And, we cover a lot of topics, really that there's no one way to manage your diabetes, that there's a lot of toxic positivity in the community and how to avoid that. And then just getting into the trauma and the grief that you have to deal with after a diagnosis, and what the first few minutes, like you just mentioned, can mean for the rest of your life with diabetes, especially for the first few years. But Mary also provided us with a lot of resources that we've included in the show notes. So this is a very practical episode. If you want to check those out, just check out the show notes or check out the podcast on diabeticsdoingthings.com/podcast. All right, enjoy this interview with Mary Mosier. Welcome back to another episode of Diabetics Doing Things. We are telling the amazing stories of people with diabetes from all over the world. Very excited for our guest today, Mary Mosier, LMFT, licensed marriage and therapy and therapist, and family therapist. I wrote in my notes therapy therapist, which is a very different and maybe overly descriptive title, but that's me. Mary, welcome to the show.
Hi, thank you for having me.
Of course.
We're so excited. We're so excited. Mary speaks English and Spanish. She is bilingual, and I feel like all of her content out there is available for people who speak English and Spanish. You've been so interesting to me on the internet. I think, Rob, I didn't tell you this, but when I was trying to make friends in the diabetic online community, I DM'd Mary and I was like, hi, I really like your content. I think you're really cool. Please be my friend. And I think that's how we started being friends. So yeah, a little backstory there.
Yeah.
Isn't it nice?
And it came during the, I think the Women of Color Diabetes Challenge. I think that's kind of when we met. Yeah, that was awesome.
How important are those, right? Like, because, both of you are very involved on the internet and diabetes communities, and yet it took a challenge for you both to get introduced to each other. So those are good. That's, I'm just going to plant that seed. If you're listening to that, listen to this, and you are responsible for one of those challenges, let's bring them back. Let's make them happen. So Mary, you have lived with type 1 diabetes for 34 years. On Mary Mosier Therapy, your Instagram account, you say a level 34 type 1 diabetics, which I love.
Yeah.
Why don't we start with your diagnosis and what you remember and how you came to join the type 1 diabetes family?
Yeah. So I have an older brother who's about 2 years older than me. So when my parents had me, I think they instinctively kind of knew, well, something is wrong. Let's run some tests. They didn't have like the understanding of what type 1 was. And I think a lot of the providers we were working with at that time never really thought to test for type 1, right? So they were like, okay, allergies, this or that, or let's check, just varying kind of tests, and always really just kind of skipping that, where my parents were like, but she complains of this, she's always thirsty, she has a sweet breath. Like I remember my parents would even tell me that anytime like we were going anywhere and they were going to put on the seatbelt, I would say like, but my tummy hurts, and it was like also like my abdomen hurting. So I began to sleep a lot and kind of lose a lot of weight, and my parents were just kind of like, there's something wrong. What are we not asking for? And it just so happened that both my brother and I were under the weather. He had a high temperature. that wasn't going down. So they took him and I to urgent care, but really thinking like, gosh, why is his temperature not going down? And the person that saw my brother in urgent care had a background with diabetes. And they were like, yes, I mean, obviously my brother's a concern and his high temperature, but they're like, we need to run some tests on your daughter. And my parents were just like, yes, let's do this. Like that day, I was transferred to the Children's Hospital of Orange, and I was there for a little over 2 weeks. And it was really hard for my family. And there was a lot of people visiting, a lot of people poking and prodding. And it is a children's hospital, so they try to be lovely and try to be
Right.
helpful. But things are happening so fast, different faces coming in, um, talking to you, touching you, and all of those things kind of happening. So that is, I think I had like a really hypersensitivity to being in medical spaces when I was a kid, for sure. So that's like a, a large portion of my story. But I don't know how much more you want me to share.
Well, I actually, so a little bit about you is like you come from a multicultural background. Not so it's like,
Yes.
I think, is it your mom that's white and your dad's Mexican?
So my dad is of European descent and Mexican, and my mom is Mexican. And Yeah, so I'm like very mixed. And I think when you look at me visually, because my skin is lighter, it's not always so obvious of like when you think of someone being mixed race or multi-ethnic or whatever language you prefer to
Yeah.
label your ethnicity. Um, but it was
How do they
definitely
handle
hard.
it?
Yeah,
Is
it
what
was
I want to
definitely
know.
hard, especially my mom's English isn't that great. Um, she's like, her writing and reading skills are amazing, but her speaking skills are a little bit harder because she learned English a little bit later in life. So there is definitely an overt understanding at a very young age of like the inequities of being with like my light skinned dad versus my tan mom with limited English, right? So there's definitely that I learned at a very young age, as far as like even school. Like when I was running late, if I was with my dad, people are like, oh yeah, that's fine. Oh, you don't have a late notice, or like, who's this? Or just the actions of folks that are supposed to be helping you was definitely very clear. And I didn't know a lot of people in my community. I grew up in a Latinx community for the most part. And I think that even in my family systems, in my extended family, there's kind of like, ooh, don't teach them Spanish, or don't. And on the other spectrum, I was like, yes, teach them both, or like raise them this way or raise them that way. So and just even like I said, what we see in community and how you're treated differently based on what you look like, which does definitely still happen today. Um, Definitely was something that I was aware of way younger than anyone really should have to be, but a reality of this world, for sure.
So with
Well,
diagnosis and with your mom, sorry, Rob, and with your mom not like speaking a ton of English, because I can definitely relate to that. I felt at times that I had to like, you were 3, right? So you're so small and your dad spoke English. So did it feel like you were still in some ways translating all the time? Or as you started to get older, like they're your primary caretakers, but because you understand English the best since you were born here, or whatever, are
Yeah.
you like that responsibility even as a really young child?
Yeah, so if we were like with our mom, definitely we would be translating. But for most visits, I know my parents did a good job in the way that everyone, it was like a whole team thing. And I don't know that my siblings were excited about it, but when anytime I had to go visit my endo at Chalk, my sister would be pulled out of class, my brother would be pulled out of class, and we would all go together. And I think that effort for them was obviously probably there was no other person that could pick us up because we live really far away from family. But then also I think they were just trying to be like, it's okay that you're diabetic, and like I was never comfortable really with getting like checkups with like male providers. I knew that very young, like just felt really uncomfortable. So they were always in the room with me, even into like my teens. Because that they were always just very present in like every medical decision. Um, so I think that that was something that they did well, where they were like, okay, we're all going, you're going to get blood work. We're going to wait here. There's a room where we're going to wait. Like, I'm going to take your brother and sister outside. Mom's going to be here. Dad's going to be here. Um, where they try to kind of like normalize the best they could, that I was diabetic, but I obviously knew that there was like stress and tension and lack of sleep all around. Because kids are aware even when we don't have language, for sure, that like, okay, like I'm causing people stress. So
And
yeah.
I'd love to, just because of your expertise on this matter, and obviously like your
Yeah.
firsthand experience as a patient and as a
Mhm.
person with diabetes,
Mhm.
there's so much trauma associated and grief associated with a diagnosis.
Yeah.
And like you said, like your family, like your brother was there in the hospital with you, like during diagnosis, you sort of did things as a family unit and had like a team kind of structure around that. Do you think that that was just unique to your family? Do you think that or, unique because you guys were kind of all there at the same time, were able to do that together? I'm sure that, like you said, there's a spectrum of how people like to manage that. Some people I think are more lone wolf and they like to sort of manage it and keep it very
Yeah.
close. But yeah, maybe
Yeah.
just on a bigger, just sort of a higher level perspective, the relationship between diabetes and trauma and grief, and mourning your sort of old life, even if you were diagnosed very young.
Yeah, so as far as like my story, and then I can certainly speak to just like medical trauma in general, because I think it's not it's a definite knowing of something that's happening to you, right? So when we're talking about trauma, it is something that happens so rapidly, whether it's an event or for others, it might be like continually ongoing. And that's definitely affecting our nervous system, our sense of the world. And when we put um, our level of access, right? So we're adding all these different intersections. What level of privilege? Um, what? How do people perceive me based on my skin, based on my language, my race, my sexuality, right? Um, my ability to communicate, right? Or people are really looking and treating us different based on all those things. So I would never tell someone like, well, just work on this or do this when they don't have adequate resources, right? So I know for me personally as a therapist, we are looking at all those things that are affecting our wellness, that are affecting our experience of trauma. I know for me, like growing up, I think my parents, for them, it was like, yes, we need to do this together. Um, and that really helped me feel a little bit more normal, whatever that really means, in the way
Yeah.
that I saw myself as opposed to other kids, right? So even like my growing up experience, I was the kid that had to go check her blood sugar at recess. None of my friends or kids in my class had to do that. I was the kid that had to, I used MDI. So I had to miss a little bit of lunch to give myself my shot and then go back, to the lunch table. So there was always this like caution and awareness that I had as a little one. So that certainly does affect the way that you move in the world. I know with folks that I've worked with that were diagnosed in their 20s, so maybe college students with type 1 or maybe a different type of diabetes, where you have this idea of the world or idea of how you're going to move in it or like what your goals are going to look like, and that can significantly, any kind of medical diagnosis really is going to affect the way you move through the world. And some, because of our lived experience, some of us don't have the safe space or emotional support to be able to grieve it. to know that we can grieve it, that that's part of having a condition, a medical condition, or any kind of traumatic experience. So that, I think that gets missed a lot, for sure.
You mentioned this earlier as well about being children and not really having the language or not being able to verbalize or articulate what we're going through, but we know inherently inside. And I think part of that too, tying into what you just mentioned, is when you're young, and I mean, I guess really this never sort of is a human condition, regardless of age, is being different and being othered because of your differences. Like there's a lot of fear and a lot of anxiety and a lot of real social challenges, like assimilating to a social group as a disabled person or a person who used to not have a disability and then now has to adjust to their space in the world. And I think especially for young people, teens, children, people in college, but also even adults, that can be, you know, the first real big hurdle in adjusting to the non-clinical portion of diabetes.
Yes. Yeah.
Talk a little
Definitely.
bit. I guess what do you see when you talk to your patients about, you know, these types of things?
So I know with like really people of varying ages, I know for little ones. So I purposely wear my insulin pump and my CGM in really overt places that everyone can always see, as a way to kind of show support for people with medical conditions. So maybe I'm working with a little one or a teenager that's like, no girl's gonna like me, or no person's gonna like me, or no, or who would ever date me. Because, you know, like when we think about disabilities and ableism, like what are we being told about having this condition, right? And then someone thinking like, well, I have this pump or I have this thing now. People are going to treat me different. And some people do. Like some people stare, they question. I know for me, I have like a really high tolerance for that. And I use that as an educational moment where I'm like, oh, that's my CGM, that's an insulin pump. I am diabetic. So next time you see someone, maybe a little one, you might want to be mindful about how you're looking at them. Or maybe the way that you know, like if you do want to ask, like instead of staring, because that can be really affect someone.
It's so nice. How do you do that, Mary? I feel like people when they're like, why are you beeping? I just want to punch them in the eye. Like, why are you asking me questions? How about that? Like,
I'm glad you said that, because I think that also exists on a spectrum. And sometimes it's just like, did you get a good night's sleep? Or are they the second person that's asked you that today, or the third, or maybe, or are you feeling a little bit more vulnerable?
You know, honestly, like on my, I don't have the capacity. I don't have the emotional bandwidth today. I will, so like today I'm wearing my insulin pump on my upper left thigh, but what I've done is actually write with a Sharpie and put, this is my insulin pump. I will literally write that. I've done that so many times, and I've seen people like when I go to like coffee shops or restaurants where someone's like, oh, what does that say? And I could hear them. You're like literally at the next table. And then they're like, oh, it's an insulin pump. Oh, she's wearing an insulin pump. And then that like just everyone's good now. You can stop staring and it's not a problem. Sometimes it bothers me, but for the most part, I'm kind of like, I'm doing this service because I know how hard it is for some of the people that I've worked, right? And I remember in high school, still with MDI, at one point, I think it was my junior year, where I was like, I am not walking to the nurse's station anymore. I'm just not doing it. So I would take my glucometer, like I would, you know, and inject myself like in the corner of the room. I wouldn't go to the bathroom anymore. I'm like, I'm just like over having to accommodate. Oh, does that hurt? So then at that point, I was just kind of like, I'm over it. I'm going to inject myself in the back of the classroom. In grad school, everyone knew. At that point, I was just kind of like, for safety reasons, people should know. And you definitely don't have to do that. Like whatever your comfortability level is, you know, do what works best for you. But at one point I was like, I'm not going to hide this very big part of me for someone else's comfort. So, and then because I hear people have like really bad, horrible date stories, or like they called me a sick girl or a sick boy, or they called me this or that. I'm like, no, that's not okay. Like, what kind of people are we raising? So if I can help in that way, I'll do that. Like for me, it's not a problem.
Well, I think too, like having to grow into some of that too. Like if you're
Mhm.
not in that place yet, I think it's okay. I
Yeah,
also,
absolutely.
it feels uncomfortable to be different, and it feels very uncomfortable to be, and I think sometimes feels embarrassing, or like you're on stage, or like everyone's looking at you when you
Yeah.
highlight something different. And so, and as you were describing, like people kind of talking about the words written on your insulin pump, and then kind of checking that box, and you sort of now know that they're talking about it, and now you're having a little awkward exchange. Like that awkwardness still exists, even if you're outwardly confident, and even if you're comfortable.
Yeah, totally.
And I think it's it's easy for us to be on a podcast and say, yeah, every opportunity that someone doesn't know is an opportunity to educate and bring people in.
No.
But I also struggle with, days where I just don't feel like being interrupted, or I don't feel like having to
Sometimes I just want to
explain.
be, right?
Yeah.
You just be. I just want to
Yeah.
exist.
And
I think
hence the why I just write it on my pump, because I'm
Yeah.
like, I don't have the bandwidth this week, but there's other weeks where I'm kind of like, yeah, and I would really encourage you to be mindful of the way that you're looking at folks. And I don't do that all the time, so it's not like my fifth day job. But I think sometimes it can certainly make a little bit of a difference to make someone help them be more aware, especially when I'm hearing stories from folks that I'm working with that someone's like, can we just end the date early?
Hmm.
Right. And that's like the hard end of the spectrum, where people are just kind of like, oof, you have an illness.
imagine being anti-sick people. That's crazy. That's
Yeah, because there
crazy.
are
Like,
people, and unfortunately, I've also heard other like people with medical conditions, diabetic and not, where they were like, "Ooh, I wouldn't date someone who also has this."
I
And I'm like,
well,
what does that say about the internalized ableism that you have?
also,
oh
like
man.
you are one phone call baby from being disabled. Like, none of us woke up yesterday and were like, oh, one day we're gonna be sick. None of us. It just happened. So, like, what do you mean, sis? That's so
Yeah.
Well,
weird.
internalize is right, and I mean, a lot of that comes from society. A lot of that comes from just, we're all trying to fit in to
Big-
a certain extent. We all want to be, uh,
Yeah.
everybody wants something different, I think, but mostly I think that we want to be
Yeah.
accepted for who we are fully, and it's difficult.
Definitely.
And I think you're right. Like I've heard people say, "Oh, well, I don't want to have kids because I don't want to risk, a child having diabetes." And I'm like, I understand that perspective, and I agree life with diabetes is hard, but if, I think again it comes back to priorities and like what you want. And also I think this is something I really want to touch on, because I am an optimist, and I think that's a strength and a weakness sometimes, is because I'll get overly
Mhm.
optimistic about ability to do things, or ability
Speak on
to
it.
things going well, right, and not leave room for maybe, a hiccup or a roadblock here and there. um, but there's also that balance of not wanting to be toxically positive. And I think that there are
Yes.
some narratives,
Yeah.
that some that I've said on this podcast, I've been guilty of like, you can do whatever you want with diabetes, and you can, live the life that you want. But also, I inherently was I'm a genetic lottery winner. I'm super tall and athletic, and was born to a family with means. So I have
Mhm.
advantages that other people don't. And so like it's important to recognize like the ableist, pillars of society, which are, oh, people who are good looking and athletic or whatever get scholarship opportunities that other people don't, and that's just the way that it is. And then
Mhm.
without saying like, oh, you can't do this, or setting up barriers. So I guess, like, how do you help people remain optimistic and positive without going into that sort of toxic territory?
Yeah. So I think it's important to be able to hold space for both, right? So I'm not going to just tell someone like, we really need to work on that negative thinking. Like, what was your lived experience that this is what you learned? And what are the things that are no longer serving you, right? Um, and what are the pieces that we do need to unlearn? So if someone told you like, hey, no one would ever want to be with you because you are diabetic, because you have lupus, or because you have this medical condition or what have you, that's that person's belief, not yours. And we can learn not to take that on, right? Or if we're just talking about like a physical attribute where you have to be this size or you have to be this body type, the reality is that we're socialized to believe that bodies should look like this, that this skin color is better, that this butt size is better, these thighs are better, whatever, right? But like, what do you actually find attractive? What do you actually like about your body? So if I'm working with somebody that really is struggling with like per se, like body dysmorphia, and they're telling me like, Mary, I just think that every part about me is just so disgusting. So I'm not going to tell them, tell yourself you're beautiful 10 times a day. I would not do that. For someone, it might be helpful, right? So what I would do is talk to them about like, tell me about what your body does for you. That is good. And we start there. Well, my body allows me to swim. That's great.
Mm.
My, I don't have mobility in this part of my body, but I'm able to be creative with this part of my body, right? So start there and then hold space for that duality of what the realities are life that is life, that there is goodness and then there's also harm, there is pain, and there is also joy, right? So especially with everything that is so amplified of what's going on with the world and people just are more insightful and aware of it now. Just even that piece, like, gosh, there's a lot of harm, but I'm not gonna allow this horridness that's happening in the world to allow me to give up. Because I hear a lot of really painful stories sometimes, and I've seen people's life, lived experience, where it's not fair at all, like what's happened to them. But I do see the hope in the way that they want to move through, and how they heal, and how I can be experiencing pain and also joy and also goodness. And so again, like that duality of, gosh, there's hardships and there's also goodness. I have depression, and I also have this amazing person in my life. I have diabetes, and I have these resources. I have this person that can be my go-to, right? So feeling like, I think it can be really helpful to know that you're not the only one. And I think that's why podcasts like these are so great, where you're just like, okay, I can relate to what Mary's saying, or like I get what Eritrea is saying, or what Rob is saying, because that was my experience when I was a teenager, or like, oh, someone gets it. Because we do feel so alone when we're going through hardship, and we think like, gosh, how am I going to surpass this?
Right.
But it is very possible. I know some people don't have as much access. So then what do I have control of? What can I do given what I have? And I think that mind shift can be helpful, especially when we have resources coming in. So I don't know if I just went off on a tangent,
No.
but I just
No, you said so much that I was just
I know. I'm like,
cry.
sometimes I'm like, I
Damn.
need to get people to digest what I'm saying.
Ay, Maria, veniste a hacerme llorar. Like, I was like, damn, girl, I'm gonna cry. Like, stop, Mary.
Well, I think it's such like, humans are so complicated and there's so many layers to us. And I think it's really interesting, like living in today where we live in a very polarized, news cycle and social media. And it can be really, we're unfortunately like manipulated into having strong reactions one way or another. And kind of we can get into these insular chambers where we only share things that we agree with. And that just becomes so dangerous and it can set up a really difficult patterns for us. But what's so interesting to me about your discussion of like life and lived experience and how it's so different from person to person, that's so applicable to a life with diabetes, because there really is no one way to manage, like, and I'm grateful that there are multiple podcasts and multiple treatment methods and multiple schools of thought on whether that's food or dieting or exercise, or multiple options on CGM and alerts and sharing and things like that. So you can, if you have the access, which is a huge part of it, you can, assemble your community, you can assemble your therapy, you can assemble, your outlook and adapt it to your lived experience, again, if you have the access. So, how do you, when you're talking to people with diabetes specifically, like, you kind of get into those cycles of grief, like acceptance and like depression and anger, like it's a cycle, like we go through them on a regular basis. How do you kind of meet people where they are and kind of help them navigate that cycle?
I really like, as we think about like that grief cycle, I see it more as a suggestion, honestly, because everybody's grief experience is different, right? So someone may need to be in their anger or may need to be in denial for purposes of survival, for purposes of functioning, or maybe we don't have the space where we can do that because we need to move or we need to keep going. So I definitely talk about that, like what feels safe and okay in this moment for you, where we can begin. So that would be maybe my first question. So I'm not going to tell someone I think you need to grieve this.
Mm.
I might just want to know a little bit about their story and what their worry is, to be in their caution to open up or not open up, right? So if we have lived experiences where we weren't met well with certain emotions, or maybe your dad, Rob, was like, yes, come to me when you're sad, let me hold you, let me help you. I know my dad was like that, like, tell me about it. But if I would have had the opposite experience, right, with a dad that perhaps had a lot of internal stuff happening where they couldn't deal with their own emotions, that dad may have like shush me away, or like, my life is harder, which I know sometimes happens culturally, where like, I came to this country to give you a better life, why are you complaining?
Mm.
Right.
I
So
walked from Africa to come here. How dare you? And it's
yeah,
like, I get it.
right. So if someone has that kind of lived experience, we talk about it like, wow, that made you feel like sadness was not good, that your anger was overwhelming, and that makes it hard for you now. That makes it hard for you to express how you're feeling. So just even acknowledging those things, I think, can make such a big difference as a way to kind of open the space a little bit.
I really, since we're going to talk about my dad, I also, it brings up different things as well, as like parents are people too at different
Yeah.
points in their own journeys. They're, maybe grieving themselves or in other cycles. And I think, we're going to talk a little bit about therapy stigma and what to do, or some advice for people who have been recently diagnosed. But, to share a little bit of personal stuff on my dad's side is like, when I was born, I knew my dad as a different guy than my half sister did, who was 18 years older than me. And, there was a lot of things that they had to work through because my dad was not available and was, an alcoholic and was absent in her life. And
Mm-hmm.
fortunately for me and my brother and my sister and my mom,
Mm-hmm.
he got a second chance to correct some of the things that he did and didn't do right, and he got a chance to reinvent himself. And unfortunately, that didn't change my sister's childhood, where he was absent and where he was hurtful and where he was uh a piece of shit. And so
Mm-hmm.
and at the same time, like, they were able to reconcile later in life and develop a different relationship. So I think that your story can change too. And
Yeah.
that's whether that's your own story related to diabetes, whether that's relationship in your life of any kind, whether family or otherwise,
Yeah.
you know that healing is possible.
Yeah, absolutely. Definitely. And I think that that's why I focus so much in the work that I do, specifically around trauma and inner child healing or attachment work, right? Because we don't all have the best of experiences growing up. And I think that that is also like a duality of healing, where your parents may have done the best that they could and still caused a whole ton of harm.
Mm.
And again, not to blame your parents, or my parents or anybody else's parents, but just to really acknowledge that, like, they were trying, um, and they still hurt me. Um, and how do I want to move forward from that? What can I take? What strengths can I take from my family system, if there were any? Some people don't grow up in spaces where there were any, right? So then my experience of trauma with my family has taught me that I don't want to be like that I don't want to repeat this cycle, that I want to have compassion, that I want to grow in a way that I'm not repeating this pattern. And that's where that comes in our healing work, where what parts of me do I need to hold and take care of and validate, um, And how can I be curious about, maybe for those that maybe didn't have the best therapy experiences or group therapy experiences, like, how can I be curious about the idea that there is the right provider out there
Hmm.
for me? Or even if we were in not the best kind of relationship, how can I be mindful of the kind of people I engage with, or why um, I lean in towards people that aren't that great. And it's not usually because you're like, yes, I love me a toxic person. It's kind of like that energy or that behavior feels familiar, right? Because maybe that energy or behavior was very reminiscent of our growing upness. Um,
So it's
I
like
think
a pattern. I guess I don't know. I don't want to like deviate too much from what you guys are talking about, but it does make me think about something that Rob's always talking about on this podcast, which is like, because right now we're talking about how like something you're living now isn't even really what you're living, right? You're like reliving a past trauma, a past experience over and over
yeah,
again.
yeah, yeah,
So
yes.
in correlation to like diabetes, something
Mhm,
Rob's always talking about is how like the first 20 minutes of your diagnosis are so important to a
mhm.
person with diabetes. So is it possible from your, expertise that if those first 20 minutes were terrible, that you're just like going like it's much harder to go through the rest of your life now with this chronic condition because of that initial bad experience?
So that can certainly
Or
be.
or good experience,
Yeah,
sorry.
so it really like depends on the person, but if you came across where people were automatically blaming you or telling your parents that they failed or that you failed, or like, why are you eating this way, or why, like, so even like in the medical system, there's like a lot of stigmas and
right.
lack
And
of
like
education.
we and me specifically, like
Mhm.
I'm very happy with the progress that we've made. People that were diagnosed today have in general much better resources
Yeah,
than
yeah,
when I was diagnosed or you were years ago. But
yes,
at the same
yeah,
time, like to say
uh,
that this exact situation doesn't happen regularly would be an
yeah.
oversight.
Yeah, for
Yeah.
sure. And again, because I work with folks that are multi-ethnic or that are in the Latinx community where maybe they don't have access to the best level of care, or maybe the language is an issue. Like, for sure, um, if we have a traumatic experience medically, it is going to affect our level of trust with our providers, or how comfortable we are with talking to them about questions that we may have, or things that we're struggling with. If they're coming at us in a way that is like, why do you have lows all the time? Why do you have highs all the time? Or what's wrong with? So if someone's talking to you that way, that's clearly indicating that they're not really trying to collaborate. Um, and I think that's something to pay attention to if we're able to, right? I really want to request a different provider. I don't feel like we're working collaboratively. I had that actually happen when I had a change of insurance, where I was like, look, I've been living with diabetes this long. And are you the provider that's going to work with me as a team? I don't want the way that you're talking to me is not going to work.
Right.
And because of where I am today with my own inner work, with my own self advocacy, I can say that. But what about someone that has never felt safe to speak in the system of medical care? Then
Well,
they're going to be like skipping appointments. And even youth that I work with, they're like, I don't check myself, whatever.
and I think too, like that wasn't easy for you to say, even though you have
It
the
wasn't.
experience
It's
and you
not.
have the credentials and you have the
Mhm.
confidence. I imagine like in your stomach in that moment, I could see it on your face when
Yeah.
you said it to us. Like there's pressure and
Yeah, yeah,
there's
because my way of being, and I think Eritrea knows this, I'm like, can we just all be like
I feel like Mary's really nice,
compassionate?
but she comes with the
Yeah,
rah
no,
rah.
see,
She'll
like
bring it.
I will if I have to, but I don't like to. I don't think we should have to be like in each other's faces like that, but we have to sometimes, and it
Do
really
you do the
sucks.
thing? Do you do the Latina thing where it's like sometimes you open your mouth and your mom comes out? That's what my mom said. She's like, a veces abre la boca y ahí estoy yo. I'm like, yep, mom, open my mouth and it's you.
hey,
So
that I
I
got
think
news for
that's
y'all.
kind of
That's not just a Latina thing. I do that too. Anita does come out of my mouth every now and then.
Yeah.
isn't it wild when you're like, you don't even
Yeah.
know parents? But yeah,
No, because my
you
mom
did
would
it.
always be like, you better get the interpreter, or you better like this. Like, she was never
That's something that I also, maybe we could talk about it more offline, but I've always wondered, like, if it was just my Latina mom that was so like, we have rights and you're not about to treat me no way, even if I don't speak English. Like, you
Mhm.
work for me through Medicaid, but you still work for me. So like stuff like that, that I wonder if like just it's in them as women coming to this country to be like, I'm gonna do what I can for my daughter, even if I don't have all the resources. I'm gonna find them. Stuff
Yeah.
like that. So that's beautiful that your mom did that for you too. I like that.
Mary, I think both Eritrea and I agree that this has been just an amazing conversation, and I think we could probably go 4 or 5 more hours on each of these individual topics. So I definitely want to invite you back to
Sure.
kind of because a lot of what you've been talking about today is something that we touch on, but because we're not experts and we're kind of going through our own journeys with mindfulness,
Yeah.
mindfulness in everything is such an amazing skill to develop, and specifically with diabetes, I think people with diabetes and people with chronic illnesses are just so much more in tune with their body because they have
Yeah.
to be. We have to advocate for ourselves, not just publicly but also privately and internally, and like, what do I need right now? And I would challenge people listening to ask yourself what you need more often outside your diabetes as well. What you need in your
Absolutely.
relationships, what you need from your uh, doctors, what you need from your boss, what you need just in general. Because
Mhm.
when you start to have that curiosity, which is something else that you talked about, it it opens you up to realize that, like, maybe we're never going to have it all figured out. And that's something that I
Yeah.
think I've been trying to reconcile, and I've talked at length about this year of, kind of my journey of like really reconciling that we as humans only live about 4,000 weeks, and life is sort of just one insoluble problem after another. And if it's diabetes today, it's going to be something else tomorrow, and then diabetes is going to come back up again because it obviously doesn't go away. So giving yourself a little bit of grace and space to
Yeah.
to navigate through that as a human.
Yes.
So I again, we're gonna have you back. We're gonna have to coordinate how often, and make sure that we're bringing you in as a correspondent, because this has just been really valuable. I think as we kind of close today's interview, I want to be mindful of time
Mhm.
for people who are struggling. Advice to people who are struggling with diabetes, and then also therapy resources that you could recommend, and especially for people who don't maybe have as much access as Eritrea and I, and who are maybe underinsured or uninsured.
Yes. So finding the right people is important. We don't actually always have those resources at the tip of our fingers. So if you're a person that has like government funded um, insurance, right? So I know in California it's Medi-Cal. Um, and normally every county in every state has a county funded mental health and counseling centers that we can find. There's also organizations like NAMI, um, NAMI.org, NAMI.org. There's, gosh, I wish I had a list I can send you. Maybe you guys can add it to
Yeah,
your show notes. I can email it to you guys.
you're a pro.
Um,
You get it. Show notes.
yeah, yeah. There's there's definitely organizations out there. There are sliding scale clinics. There like myself, I am private pay, so I don't take insurance, but I do offer a sliding scale. But that sliding scale, those tend to be folks that I see more long term. So those spots aren't always open, and you can always ask a provider that question for sure. Like, do you offer sliding scale? This is what I can pay. Um, for folks that use an out of network provider that maybe their insurance doesn't have an open therapist that has availability when you need it, you can check with your insurance about a super bill, which is basically an itemized receipt of all your sessions that you would have in a month with a therapist, and you can ask your insurance provider, hey, I there's this therapist, their name is Tom. This is their license information, and I want to work with them. What is your reimbursement rates if I go with an out of network provider? And I request a super bill. So that's kind of like the language you want to use with your provider to see if they would reimburse you after you submit that super bill to your insurance. So there are certainly options. And also another thing, most colleges throughout the United States offer, because they are training facilities, they offer lower fee counseling to students and non-students in the communities where the colleges are. And one of the reasons is because they are training sites. So they're not charging folks to see a therapist in training.
Thank you for that. And
Yeah.
just to reiterate, yes, we will include all of those in the show notes. I jotted them down, but we'll also send you a follow-up just to make sure we didn't miss anything.
Yeah, of course.
And then I guess just
we mean it. You will be back. We're telling the listeners now.
Yeah.
Yeah, I'd be happy to. Yes.
This is so great.
Us.
You know, I guess just as a closing note for today's episode, we give it, you know, I try to put people in their shoes when they were first diagnosed. I think you obviously were very young, so maybe that's not as applicable, but just advice with somebody out there who's listening to this and has been, you know, struggling with the weight of a chronic illness, struggling with, you know, all of the things that come along with it, anxiety, depression, body image, eating challenges. Yeah. What advice would you give for people with diabetes who are struggling?
I would definitely say that it's okay to feel that everything sucks, and it might feel like it sucks for a while. But there are people who want to support you. There are people in this world who have felt very similarly to you. And you don't have to compare your diagnosis to anybody else. Like even within the three of us, the way that you live with diabetes, it may not be the way that I do, and that's perfectly okay. And the way that I advocate and you advocate, or someone else doesn't have to advocate, it's okay. It's okay if it sucks. It's okay to grieve it. It's okay to be super angry, to feel like life isn't fair.
Big time.
And I also want to tell you that it's not always going to be that way, because we all have our moments with events and crappy stuff that happen in our life, but we can also certainly learn to live with it. I would definitely not be a therapist if goodness doesn't come out, if healing doesn't come out from our lived experiences, because this job would be all kinds of horrible if goodness and healing didn't come after the pain.
Yeah. Well, I couldn't pick a better note to end this episode on. I believe that
I can. Mary is fine, y'all, by the way. She's very pretty. I just thought you should know. I was like, pretty, smart, all of it. All of it. So thank you so much. I could listen to you talk about mental health and educate us all day long. I can't wait for you to come back. And now, Rob, I'm sorry to have taken that from you, but I had to say it. I had to let the people know. Check her out on Instagram. Great commentary. Also very nice looking. Check it out.
Don't send me pervy DMs. I'm not interested.
No, don't do that.
Yeah, don't do that. Please. But she is Mary Mosier Therapy on Instagram. We'll include her handle in the show notes. And Mary, again, thank you for your time and for your insight and for all that you do for people with diabetes. And you'll be back.
Yeah, happy to. Thank you both.